I lost a family member suddenly to cardiovascular disease in 2021, and many of us in this room have likely lost someone we care about to it as well. In the US, over 120 million adults have cardiovascular disease. The reason behind this might not be a lack of resources, but how we're using them. The US spends over $300 billion each year on cardiac care, much of it on acute events that could have been avoided. In fact, about half of all cardiac-related emergency room visits, hospitalizations, and procedures could be prevented with timely care. Unfortunately, most people can't get that care soon enough. The average wait to see a cardiologist in the US is over a month, and in many areas, it's more than 3 months. And even after that first visit, there are often delays and mix-ups when getting testing and treatment, with too many people falling through the cracks along the way. That's where we come in. At Empallo, patients get seen in days, not months. Currently, most people find us after something concerning shows up in primary care, such as an abnormal blood pressure, cholesterol, or electrocardiogram. The primary care provider typically sends them to a traditional cardiology clinic, but faced with a 3-month wait, the patient goes online, searches for better, faster ways to get care, and books an appointment with us. Empallo enables comprehensive cardiac care that is personal, proactive, and built around the patient. So, how can we do this when others can't? We built a tech-enabled cardiac clinic that is automating everything that shouldn't take provider time, so clinicians can focus on patient needs. Unlike most clinics, we did not try to retrofit old systems. Instead, we built our platform from the ground up on modern infrastructure so we can be responsive to feedback from patients and providers. We operate in a way that other clinics built on legacy systems simply cannot replicate because their infrastructure doesn't support it. Our care model is virtual first, making care more accessible and operations more efficient. If you're wondering whether top-notch cardiology can really happen virtually, well, so are some of our patients. Then they met us. As you can see from a few of the public reviews our patients have shared, many were surprised by how easy our platform is to use and how thorough our virtual care is. How we asked questions that their in-person doctors never had. How we made it easy to get all of the diagnostics and medications that were needed. And how we built care plans that finally worked for them. We've completed hundreds of appointments since launching earlier this year, and have shown that we can deliver excellent care with high retention and strong unit economics. We now operate in 8 states and counting, and we are in network with most major health plans, including Blue Cross Blue Shield and United Healthcare. We've brought together an incredible team that cares deeply about both preventing heart disease and helping those who already have it live longer, healthier lives. My background in consulting, finance, and product management taught me how to think cross-functionally and scale products. Our medical director spent over 20 years leading heart failure and transplant cardiology at Kaiser Permanente, Northern California, and our technical team has built healthcare products across startups and large health systems. The moment for cardiac telehealth has arrived, and we are expanding access to millions who have been left waiting, making them feel heard, understood, and cared for. If you want to join us on this journey, please reach out. Thank you.